Our next speaker is Ms. Yolanda Pickstock. Ms. Pickstock is the Legislative Director at Georgia Stand Up.
Good afternoon to the committee, and thank you for this opportunity to address you about the need for Medicaid expansion in the state of Georgia. Georgia Stand Up is a 501c3 Think and Act tank advocating for unserved and underserved communities in the state of Georgia. Throughout the Medicaid eligibility redetermination process, Georgia Stand Up has partnered with elected officials, many of you, community leaders, and faith organizations across the state to raise awareness about what was going on under Medicaid unwinding and educating enrollees about the process and insurance options for their families. Since the beginning of the Medicaid eligibility redetermination outreach program in June of 2023, we heard a common frustration from Medicaid-eligible recipients, whether they were in the Atlanta metro area or rural areas of the communities of the state. The system is ineffectual. Recipients were experiencing long hold times and courtesy disconnects, resulting in limited access to caseworkers. Understaffing created an overwhelmed and stressed out workforce. I spoke with a former DFAS employee who left the agency after 16 years because the stress was taking a toll on her mental and physical health. She described her work as a labor of love, which was innate to her because serving others was a passion for her. But she left the agency, sadly, because she also felt that she was unappreciated by her supervisors. At Georgia Stand Up, we applaud the state for flipping over the cushions on the couch and digging between the seats of the car to find enough money to hire additional services, hire additional staff to train for the Medicaid unwinding, and also to address the issue with the number of children who have lost their coverage since the start of the Medicaid unwinding. The number of children who have lost CHIP and Medicaid has declined by 149,080. Georgia is one of 9 states with the largest number and highest percentage of children who have lost Medicaid or CHIP coverage, which is a 9% drop since March of 2023. In states where Medicaid has been adopted, maternal mortality rates are lower. Black women are 3 times more likely to die from preventable pregnancy-related complications as white women. Black women have lower rates of health insurance, therefore cannot afford pre-pregnancy and prenatal care they need to reduce pregnancy complications. Georgia remains one of 10 states that has not adopted full Medicaid expansion under the Affordable Care Act. Instead, Georgia's Pathways to Coverage program has partially opened Medicaid, claiming the program will increase access to health insurance for its uninsured adults. And as we've heard today, less than 2,500 have enrolled in this program. The Pathways programs has requirements, conditions, and exclusions that continue to limit access to health care coverage by tens of thousands of citizens. Coverage is limited to working-age adults earning up to $14,580 for a single person or $30,000 for a family of 4. These are unreasonably low limits that still leave a significant gap in coverage. The program also imposes a 80-hour per month work requirement on all applicants with extremely limited exemptions, such as people with disabilities or care responsibilities that may prevent them from holding jobs. With Pathways, Georgia is the only state to partially expand Medicaid with a program that forces recipients to work, to volunteer, train, or study to be eligible for health care coverage when there is a nationally subsidized full coverage program available at a lower cost per capita without these coercive restrictions. The program also puts enormous reporting requirements on recipients, requiring monthly reporting on their work compliance for the first 6 months, in addition to annual reports. This bureaucratic requirement unreasonably disadvantages low-income and technology-limited households, those who need coverage most. I want to state clearly that facts matter, and the fact is Georgia is deliberately failing its working and low-income families by refusing to offer full Medicaid expansion when that program covers more people, is less expensive, and more easily accessed than the Pathways program. This has resulted, among other things, in thousands of Georgia's children being denied medical coverage during their formative years and preventable and astonishingly high maternal mortality rates, especially among women of color. As a taxpaying citizen, I implore the state to do the right thing and walk away from this flawed Pathways program, stabilize staffing in DFAS, compensate the DFAS employees for their extraordinary work, embrace full Medicaid enrollment, and create a system that improves the client's experience with accessing services. It's the right choice for our children and for all the people of Georgia. Thank you.
I want to thank you. Thank you for Dr.
No, Yolanda, just Yolanda.
Miss Yolanda. All right. Sound okay. Thank you for being here and thank you for your strong words. And I just want to go back to something you said. You said this program will cover more people, it will be cheaper, and the services will be faster.
Yes.
And you also said that we as a state, that we are failing minorities and low-income families by not expanding Medicare, right?
Yes.
So why do you think that's so? I don't want to sit here and infer that someone would intentionally, that a group of people would intentionally try to not provide testing. I'll speak up. It's working. Any of them working? Testing.
Big brother.
Yeah.
Talk loud, you're aware.
Testing. Oh yeah, I can definitely talk. I seriously wouldn't want to conclude that someone who's elected by the people to represent the state of Georgia or a group of folks would be intentionally trying to harm minorities or low-income individuals by not going with the simple solution that we see right here in front of us. What do you think is happening here, and what can we say to the people of Georgia, those that are hurting, those in rural Georgia, near Columbus, Georgia, where I'm from, looking at some of the outer areas and knowing the healthcare deserts that we have there and the disparities? What can you say to them that's happening by the people who should be representing them that right now appears to be severely neglecting them?
That's a hot potato, and I am not going to grab it, but Georgia Stand Up has been advocating for Medicaid expansion for many years, and with our sister organization, We Vote, We Win, spent a year asking people across the state of Georgia to call their governor and ask him to expand Medicaid. Early on in that campaign, about 2 months in, the phone number no longer worked. And we spent months putting little sticky pieces of paper on our cards that we had printed with a new number so that they could call their governor and ask for Medicaid expansion. I have no idea why the state has made the decision that it's made, but I do know the impact as we move across the state and talk to people day to day who are making life choices that are terrible, that we would not want to have to make. And under this Medicaid unwinding, unfortunately, too many families were not learning that they had lost their coverage until they had to take their child to the hospital because they were having an asthma attack, or they had to pick up grandmom's prescription, and then they found out that they no longer had coverage. And we're finding that people who are now discovering this don't know what to do. We were on a call with CMS, and we asked them, what would this state do to make people whole who had lost their coverage, who then incurred medical expenses that they could not pay? And we found out that what would have to happen is that the doctor would have to reimburse that patient and then file for Medicaid. And we know that the likelihood of that happening is not going to happen. So people have had to make hard choices between paying for food and paying for medication. And we talk to those people all the time.
Greetings. Thank you so much for your testimony. I'm State Representative Andisha Thomas of the 65th District. I want to thank you for what you do at Georgia Stand Up. In this realm, as well as in voting rights, you guys have been superb in that. Yes. It's there. You guys have been superb in those areas. I literally just left a meeting that had nothing to do with what we're speaking of today. In that dialogue with one of my Republican colleagues, they literally said that Medicaid was a waste and that people can't, let me get this straight, when they go to apply for Medicaid, they don't qualify. Now, I know your agency works with hundreds of participants. Can you verify that statement to be true, that the individuals that you are working with that need Medicaid don't actually qualify for it once you put the process through?
So we don't actually go through the enrollment process. We are educating and advocating. So we are meeting the people that are going through this eligibility redetermination process and trying to educate them about what their options are, and finding that those who have been terminated without cause, those who still have eligibility and should be on Medicaid, we teach them how to go back in and reapply, or educate them about the process of reapplying or filing an appeal. So I've not met anyone who was under 100% of the poverty level, who qualified, who could not get Medicaid. What we're finding is the people who were on Medicaid who are being procedurally terminated.
Good afternoon, Yolanda. It's
Hi,
good to see you
You
again.
too. Happy New Year.
Happy New Year to you too. First, I want to thank you for your work, and I know that you personally go to a lot of these areas with Georgia Stand Up, because you came to my area when we were trying to inform constituents about being taken off the rolls, and literally I was meeting people in their cars whose children have been taken off the rolls, and they have recently found out. Back this summer, you had specific numbers and predictions, and I wonder now, since we're in 2024, and I believe the unwinding ends in April, if I'm correct?
That is
The
correct.
process ends. Do you have any kind of update that you can provide to us? I know that might be putting you on the spot. If you don't, that's okay.
So for those who have re-enrolled, I do not have that data. Unfortunately, in the state of Georgia, for the first 2 months under the Medicaid eligibility redetermination process, we could go into the website, the numbers were posted right there on the front of the website. You could download those numbers. Because the numbers were so abysmal, all of a sudden the link disappeared and we could no longer find the data. Representative Schofield, who just left, was able to get the data back in August through a direct request. So we have not gotten numbers since October. And in October, at that time, there were approximately 349,000 procedural terminations. Now, we've asked for clarity about what that means, and what we have been told is that that number included people who may no longer have been eligible, or mothers who were postpartum past 1 year who were still on, who had fallen off, or could have included people who had aged out of the system. But we don't have that data. Georgia is one of the states that chose to give its data in aggregate numbers and does not break that out. So we can't determine how many of those people may have still been eligible and should have remained on Medicaid.
And thank you, Yolanda. I'm Representative Lisa Campbell, House District 35 in North Cobb. Your organization helped us with the Medicaid Unwinding informational event. And I think, interestingly, we held it at a library
Yes.
a couple of weeks before Christmas. And kids could go see Santa Claus, and parents were going to see if they could get health care coverage. So I thank you for that work. There were many with questions, and I bet everyone on this panel received at least one, and maybe more a day, calls from constituents who are beside themselves because they are making these choices about whether or not to see a doctor, to purchase food, or to purchase pharmaceutical drugs, to care for conditions like epilepsy or diabetes. I wanted to know if you could expand a little bit also on the pathways reporting requirements for work. It's my understanding there are no exceptions for caregiving or high child care costs. You mentioned there may be some extreme. I think it would be interesting for people to understand the double burden that we're putting on our families, especially new mothers, who may have been dealing with healthcare issues before pregnancy, during pregnancy, postpartum, and now have a work requirement and cannot care for their young children who now may be 2, 3, 4 years old.
Yes, we've not had a lot of contact with people who have applied for the pathways or who have been accepted under pathways, with it being just about 2,300 people across the state, so we're not meeting them very often. But we have heard from organizations. One of our community partners is Care Can't Wait, who advocates on behalf of care workers, that people who have to provide care to family members, whether it's children or even their adult parents, some of them can no longer work, and they do not qualify under the Pathways program if they are in that particular economic requirement, and they have to stop working, then they can't qualify.
Quick question, it's reference the paperwork that's required.
Yes.
Is there any attempt to sort of shorten that or make it easier? I mean, I'm getting concerns from those who help people get re-certified and things like that, and they're just saying the paperwork alone is just, just so much. Is there any way we can?
I'm sure it can be done. We've sent a rover to Mars, so I don't think it's that hard, but it hasn't been done. It can be done, yes.
But it has not been done.
It has not been done.
Okay, so you're still working at NASA, trying
Yes.
to figure this out. Okay.
Okay.
Is that, I mean, but seriously, is that where we have to go to do this? Because, I don't think, those who require this, which is us at the state,
Right.
should we not have some forethought in saying, okay, hey, we know some of these people are elderly, they don't, and maybe some are illiterate. So some of this paperwork piece, I guess we can do it, but I like an effort to do it. That's one thing
I
know we
agree.
can do. Okay.
I am incredibly proud of Yolanda and her team today for testifying at this hearing on Medicaid expansion and Medicaid unwinding. It is so important that we advocate for these issues at the Capitol, but also in the streets. So this is a true opportunity for Georgia to do the right thing. Georgia Stand Up is asking the governor and the legislature to expand Medicaid and expand it now.
We just completed testifying at the Medicaid Expansion Committee, and I believe they were receptive to our testimony. There have been several subject matter experts who testified before us and a few more to come, but it's my hope that Georgia Stand Up's work over the past year and going forward will help to move this state toward expanding Medicaid. We are one of 10 states yet to expand Medicaid, and this is an opportunity during this Georgia Assembly session of 2024 where we can finally push this over the line. And Georgia Stand Up will coalesce with its partners, working with its elected officials, faith-based organizations, and organized labor to finally make this a reality for folks in the state of Georgia so that people who need access to care can take care of themselves and their families.